All right, today we're going to examine a fascinating phenomenon in implant dentistry, peri-implant bone corticalization. And we're going to explore why it might actually be a sign of an unfavorable prognosis.
You know, when it comes to replacing missing teeth, dental implants are really the gold standard. Their use spans from simple procedures all the way to complex maxillofacial reconstructions, and they have a fantastic track record for long-term success. But we also know that some implants do fail over time.
So that leads to a really important question. What's going on at the biological level? What factors in the patient's own jawbone are the deciding factors for whether an implant will last for the long haul?
So here's our roadmap for this explainer. We'll start with a quick refresher on implants as the standard of care, then dive into how the bone around them remodels. We'll look at how we can actually measure this change, called corticalization, and then uncover a pretty surprising clinical correlation from a long-term study. Finally, we'll unpack what this all means for the future.
Okay, so first let's just briefly touch on the established role of dental implants as our primary method for tooth replacement. Now, let's get into the biology of what happens after an implant is put to work. You see, the jawbone isn't static. It's a living tissue that actively responds and remodels itself based on the new mechanical forces from the implant. And a huge part of this response is something called corticalization. It's basically the process where the spongy, porous bone right next to the implant transforms into a much denser, more compact type of bone. Now, intuitively, you'd think this is a good thing, right? Denser bone sounds like stronger bone, a positive adaptation.
And take a look at this. This series of images shows you exactly what we're talking about. These are radiographs taken over a 10-year period. You can clearly see a visible increase in the bone density right around the neck of the implant. The bone just looks brighter, more solid as time goes on.
But here's the thing. Just looking at an X-ray and saying, it looks denser, isn't enough for real clinical science. To truly understand what's happening, we need a way to measure this objectively. We need hard numbers. So how do they do it? Well, researchers use a pretty advanced technique called digital texture analysis. They take high-quality intraoral radiographs and use software to analyze the very structure of the bone in a way that the human eye just can't.
And this image here breaks it down beautifully. They select very specific regions of interest, or ROIs, on the radiograph. By analyzing the texture in those specific spots, they can calculate a numerical value, and that value is called the corticalization index, or CI. It gives us a precise number to track just how much that bone is densifying.
All right, now we get to the really fascinating part. We're going to look at the unexpected findings of a 10-year study that tracked this very phenomenon. So, for 10 years, researchers meticulously tracked two key things. First, that corticalization index, the CI number we just talked about. And second, something called marginal bone loss, or MBL, which is exactly what it sounds like, the amount of bone height lost at the top edge of the jaw.
And this graph, this is the heart of the entire study. The blue line represents the corticalization index, and the red line shows the marginal bone loss. And here's the shocker. Instead of being opposites, they move together. As the bone gets denser, as the blue line goes up, the amount of bone being lost also goes up. It's a direct proportional correlation.
And just to be clear, this isn't some random coincidence. The statistical link here is incredibly strong. A p-value of less than 0.001 means the result is highly significant. This is a real, measurable relationship.
The raw numbers in this table tell the exact same story. You can see how the average corticalization index increases over the first 5 years. And right alongside it, you see the marginal bone loss steadily increasing, nearly doubling from the 5-year mark to the 10-year mark. So, this forces us to completely reinterpret what we thought we knew. Why would bone that appears stronger on an X-ray actually be associated with a worse outcome? Well, the answer might be in the bone's very physiology. So let's put it side by side. The old way of thinking was that denser bone meant a strong, healthy response. But the study's conclusion is the complete opposite, that this increased density is directly linked to bone loss and is, in fact, an unfavorable sign. A leading theory is that this super-dense cortical-like bone has a much poorer blood supply, and without good vascularity, the tissue can't repair itself from microdamage, making it brittle and more likely to resorb under stress.
The researchers who did the work stated their conclusion with absolute clarity, saying, "The phenomenon of peri-implant jawbone corticalization clearly seems to be a condition that is unfavorable for the future fate of bone-anchored implants. That is a major shift in how we understand the body's response to implants."
And this leaves us with a critical question for the future of implant dentistry. Could we start using the corticalization index as a routine diagnostic tool? Could it help us predict the long-term health of an implant and maybe even allow us to intervene before significant problems begin?